Hi, my name is Shelby Adkins, and I'm going to be speaking on the topic of robotic surgery. The title of my presentation is Robotic Surgery, Past, Present, Future. Bishoy Morris states in his article titled Robotic Surgery, Applications, Limitations, and Impacts on Surgical Education that a surgical robot is a self-powered, computer-controlled device that can be programmed to aid in the positioning and manipulation of surgical instruments, enabling the surgeon to carry out more complex tasks. The main purpose of robotic surgery is to make the surgery less invasive, with small incisions, less complications, and quicker healing process. The beginning of robotic surgery begins in the 1980s. This is the first time that robots have been implemented into medicine. The very first robot was the arthrobot that was used in orthopedic procedures. The next robot created was the Puma 560, and it was used in brain biopsy procedures. The next robot that was created was the RoboDoc, and it was used in a total hip arthroplasty. The RoboDoc was the first robot approved by the FDA. Currently, robots are widely used in medicine. The robots are not working independently from the surgeon, but rather assisting the surgeon in the procedure. There are advantages and disadvantages that are currently being discussed about robotic surgery. The main advantage is the greater degree of freedom that the surgeon is able to use to reach farther into the patient. Robots also make the surgery less invasive, as previously discussed. The main disadvantage of robotic surgery is the upfront cost that is associated with robots. With the large price tag, it is harder for smaller medical practices to purchase the robots. Another disadvantage is the upgrades on the robots that will need to be made periodically so that the surgeons are not working with out-of-date equipment. The use of robotic surgery is expected to increase. Many researchers and physicians are developing new ideas to build on in the future. According to Michael Mack in his article, Minimally Invasive and Robotic Surgery, he discusses the idea of motion scaling, in which a surgeon could use gross hand movement that a robot scales down the exact movements in the patient. Not only should new ideas be developed for the future, but also improvements should be developed in current robots. For instance, the design of the robot could be redesigned to make it more efficient and effective. Another improvement would be upgrading the program within the robot to make it run more smoothly. In conclusion, Anthony LaFranco states in his article, Robotic Surgery, A Current Perspective, that robotic technology is set to revolutionize surgery by improving and expanding laparoscopic procedures, advancing surgical technology, and bringing surgery to the digital age. These are the references I used to develop my presentation. Thank you.